What signs do doctors look for in post-op monitoring? After surgery, especially in plastic surgery, doctors closely monitor patients to ensure a safe recovery and to catch any complications early. So, what specific signs do they look for? First, they check for signs of infection. This includes increased redness, swelling, or warmth around the incision site. If a patient experiences persistent or worsening pain that goes beyond the expected discomfort, that is a concern. Unusual or foul-smelling discharge from the wound is also alarming. Additionally, fever, chills, or a general feeling of fatigue can indicate an infection. Changes in the appearance of the scar, such as edges pulling apart or increased tenderness, requiring immediate attention. Next, doctors assess wound healing and tissue health. Delayed healing or incisions that remain open or leak fluid longer than expected are red flags. They look for dark or discolored skin near the surgical site, which may suggest tissue necrosis, meaning the skin or fat is dying. Hardness, lumps, or abnormal textures under the skin could signal fat necrosis or seroma, which is a fluid collection. Unexpected pain that worsens after initial improvement or numbness might indicate nerve injury or compromised tissue. Monitoring these signs is crucial to detect poor blood flow or other complications that could affect recovery. For surgeries involving tissue flaps, doctors evaluate circulation and vascular status. They observe blood flow to the transplanted tissue and may use tools like Doppler ultrasound. Changes in skin color around the surgical area, such as unusual redness or a bluish tint, can indicate vascular issues. Early detection of these problems is vital to salvage tissue and prevent flap failure. Fluid collections, such as seromas, are also monitored. Doctors look for lumps or cyst-like areas near the incision that may be fluid-filled. Clear or yellowish discharge can be normal, but if the fluid is thick, colored, or foul-smelling, it suggests infection. A wave-like motion under the skin when tapping the area may indicate fluid accumulation. While seromas are common, they need to be monitored to avoid complications. Pain and sensory changes are another focus. Doctors track pain levels to ensure they align with normal recovery. Severe or increasing pain is a warning sign. Loss of sensation or numbness that lasts longer than expected may point to nerve injury or infection. Lastly, general patient well-being is assessed. Vital signs like temperature, heart rate, and blood pressure are routinely checked. Signs of systemic infection or complications, such as fatigue or respiratory symptoms, are evaluated. Any unusual symptoms distant from the surgical site, like urinary tract infections or skin rashes, are also noted, as they may indicate systemic stress or infection. In plastic surgery, vigilant postoperative monitoring is essential for early detection of complications and to ensure optimal healing. Patients are often educated to report any abnormal signs promptly. This comprehensive approach, combining clinical examination with diagnostic tools as needed, helps maintain patient safety and supports the best possible surgical outcomes. Always consult healthcare professionals for personalized medical advice.